All right, Salim Rizai here, back again, and we're going to be talking about reducing post-lumbar puncture headaches. So there's a set of things that we can do, and I know we talk about treatment for post-lumbar puncture headaches, but really the best treatment is prevention. And so there are some things that we can do to help reduce the incidence of this happening. So the first thing is size matters. The size of the needle that we use is of utmost importance. So your optimal needle size is probably going to be anywhere from a 20 to a 22 gauge. If you go smaller than a 22 gauge, there's two problems. One, it's not efficient. It takes forever to get fluid out. And two, it can give you a falsely high opening pressure. If you go greater than a 20 gauge, well, it's efficient, but there's a higher incidence of post-lumbar puncture headaches. So really we want to kind of stick with a 20 to 22 gauge needle. The second thing is the type of needle that we use is also important. You really want to use a blunt tip needle, not a beveled needle. The blunt tip needle kind of moves the dural fibers aside as opposed to a beveled needle that can lacerate fibers and create a leak. Now, if you don't have a blunt tip needle and all you have is a beveled needle, what I would say is that how you position that bevel is important. You don't want to insert it perpendicular to the dural fibers. You want to make sure that that bevel is parallel to the dural fibers. The next thing is, before you take your needle out, replace the stylet. This has been shown to actually decrease the incidence of post-LP headaches. Some of the thought is that maybe we suck some things into the needle and that creates an opening that takes longer to close, and so there's a higher incidence with that. So just by simply replacing the stylet before taking the needle out can help reduce that incidence. There used to be this dogma of after the procedure, these patients have to lay flat for so many hours. That's actually been disproven. It's actually good for them to get up and start walking around. So laying flat post-procedure doesn't seem to decrease the incidence of post-LP headache. And then the last thing, and this hasn't really been studied, there's no randomized clinical trial that I'm aware of that looks at one attempt versus multiple attempts, but it just makes pathophysiologic sense that the more times you insert a needle, the more holes that you're punching into the dura, the more likely there's going to be a leak. So you really want to try and reduce the number of attempts that you're doing for your LP. Now, what are some of the treatment options? Let's say prevention didn't work. Well, a lot of people will just reflexively give IV or PO fluids, and it doesn't turn out that that actually reduces or decreases the incidence of the headache or improves the significance of the headache. The second option is IV or PO caffeine, usually given in 500 milligrams. It has been shown to improve post-LP headaches, but there's a high recurrence rate once that wears off, as high as about 1/3, 30% of patients. Now, just a fun fact, a cup of coffee has about 50 to 100 milligrams, depending on how many shots of espresso you put in there, and a can of soda has anywhere from 25 to 50 milligrams of caffeine in it. And some people will use those as kind of adjuncts if you don't have IV or PO caffeine. And then the last thing is a blood patch, which usually requires a specialist like an anesthesiologist or someone to come in and put 20 to 30 cc's of the patient's own blood to help kind of create a clot to prevent the leak from happening for the CSF. Now, I have a blog post on Rebel EM called Post-Lumbar Puncture Headaches. If you just do a Google search and put in this, it will be the top thing that comes up on the Google search. I have all the references, all the studies going over these tips and tricks. Let me know your thoughts and comments, any questions you have for me. Thanks for tuning in, and until next time.